Hello and welcome to MLab 1231, Parasitology and Mycology. My name is Dustin Scott Brewster, and this is going to be the third and final presentation for the class Trematoda. In this presentation, we're going to discuss the first organism, Paragonimus westermani, also known as the Oriental lung fluke. Infection with this organism causes paragonimiasis. This organism can be found in areas of the Far East, Africa, and South America, and infection occurs when a human host ingests the metacercaria contained in an undercooked crab or crayfish. Because this organism has a lung migration pattern, we often see encapsulated eggs found in lung biopsies of infected humans. The egg itself measures between 80 and 125 by 45 to 65 microns. The operculated end often is broader with shoulders, where the abopercular end has a terminal thickening. The adult worm measures 7.5 to 12 by 4 to 6 millimeters and is often reddish brown and plump looking. The life cycle of Paragonimus westermani begins when the unembryonated egg is excreted from the human host through the sputum or is passed in the stool. Once in the environment, that egg is embryonated, where a myristidia is released and penetrates the first intermediate host, the snail. Inside the snail, that myristidia will go through a developmental process where it'll eventually become a cercaria. The cercaria will then leave the snail first intermediate host and invade the second intermediate host, the crab or crayfish. Inside the crab or crayfish, that cercaria will go through another developmental process and mature into a metacercaria. Inside the crab or crayfish, that metacercaria, if ingested by a human, will begin infection in the human host. That metacercaria inside the human will then exist in the duodenum, penetrate the intestinal wall, travel through the peritoneal cavity, the abdominal wall, diaphragm, and eventually into the lungs. Once in the lungs, that metacercaria will encapsulate and develop into an adult worm. Symptoms of Paragonimus westermani, because of its lung migration pattern, can cause severe cough, bloody or blood-tinged sputum, and chest pain. On the left-hand image here, we have the operculated end with shoulders and a broader looking appearance, and the abopercular end, the opposite side, has a terminal thickening we see here. To diagnose Paragonimus westermani, we need to recover the eggs in the sputum or the stool of infected patients and identify these morphological features. Also, we often get lung biopsies where we can stain and visualize these encapsulated cysts. It should be noted that metacercaria can migrate to tissues other than the lungs, such as striated muscles or the brain, and that process will result in an incomplete life cycle of the organism. It should also be noted that Paragonimus westermani infection is often mistaken as tuberculosis because of their similarities and the way they appear on chest x-rays. The next group of organisms we're going to cover are going to be the Schistosoma species. These are known as the blood flukes, and these organisms are going to be a little bit different than the other trematodes we've discussed because these organisms are actually sexually dimorphic. So the other trematodes we've discussed so far in these three presentations have been hermaphroditic, So the blood flukes are going to be unique in that they have two different sexes. The three organisms we're going to discuss include Schistosoma mansoni, known as Manson's blood fluke, named after the person that discovered it. This organism is found in Africa and Central and South America. Next, we have Schistosoma japonicum, known as the Oriental blood fluke, and is found in areas of the Far East. Next, we have Schistosoma hematobium, known as the bladder fluke, which will again make more sense when we talk about the life cycle. And this one is found in Africa and in areas of the Middle East. A couple of things to note about the blood flukes is one, Schistosoma mansoni can feed off of red blood cells from the human host, and in fact, that ingestion of red blood cells can become so severe that patients can become anemic. There's been a correlation between Schistosoma hematobium infection and bladder cancer. And of the Schistosoma species, we need to note that these infections are actually quite prevalent, and they rank second behind malaria in the number of annual mortalities, averaging about 800,000 people annually. To identify the three different Schistosoma species, we can look at the egg of these organisms and note some distinguishing features. First, we have the egg of Schistosoma mansoni, and we can see that this organism has a large lateral spine. Next, we have Schistosoma japonicum, which has a small lateral spine. And the third schistosome is Schistosoma hematobium, which has a large prominent terminal spine. So these morphological features are going to help us distinguish these organisms. And next we're going to talk about the life cycle, which will also be a distinguishing characteristic. These two organisms, Mansoni and Japonicum, because of their life cycle, are going to be found in infected patients' stools, whereas Schistosoma hematobium, because of its life cycle, is often found in the urine of infected patients. So for the life cycle of the Schistosoma species, we're going to begin with the eggs being eliminated from the feces or urine, depending on the species of the infected human. That egg will then hatch and release a myristidia, which will then swim and penetrate the intermediate host, the snail. That myristidia will then undergo a developmental process to produce a cercaria. That cercaria will then swim and penetrate the skin of the human host, and that is how humans become infected with the Schistosoma species. These cercaria swim and directly penetrate the skin of the human host. So these infections are actually quite common in rice fields and areas and swamps where people are going to have contact with those cercaria, and where the snails that are part of those life cycles are indigenous to those organisms. So once the cercaria penetrates the skin of the human host, the cercaria will shed its tail and become a schistosomule. The schistosomule will then migrate through several tissues to reach the final destinations in the intervascular space. The adult worm will then travel through the mesenteric venules and, depending on the location of the species, migrate to where it will begin to develop. For Schistosoma mansoni and Japonicum, that migration will lead it to the intestinal lumen, where it's passed in the feces, while Schistosoma hematobium is going to migrate to the bladder and the ureters, where you find that organism in the urine. So the symptoms for Schistosoma mansoni can include dermatitis due to the penetration of the cercaria at the site of infection. This organism can produce bloody diarrhea, Seamer's pipe stem periportal fibrosis. This can result in portal hypertension as well as neural Ebola egg granulomas. Symptoms for Schistosoma hematobium include hematuria or blood in the urine. It can cause scarring in the urinary tract, can cause calcification, as well as squamous cell carcinoma. And then rarely with Schistosoma hematobium, we also have neuroeboli egg granuloma formation. For Schistosoma japonicum, we often see cerebral atrophy, hepatic pulmonary cirrhosis, and central nervous system symptoms can often occur when the eggs become lodged in nerve tissue. To diagnose the schistosoma infections, for Schistosoma mansoni and japonicum, we need to note that because of the life cycle of these organisms, the eggs are going to be found in stools and often in rectal biopsies. For Schistosoma hematobium, because of its life cycle, the eggs of this organism are going to be recovered in the urine from infected patients. So that's going to conclude the third of our three-part presentation on the class Trematoda.